And I will start with you, thank you, from the Cancer Council, I think. First name?
Aruni.
Irene?
Aruni.
Thank you.
To quote the state member for Hornsby, Matt Keane, most people would rather spend their last days in the comfort of their homes, pain-free, with the required services and surrounded by family and loved ones. But sadly, this wish is becoming a privilege. As a result of lack of palliative care services, countless people are denied this necessary support, while a parent, grandparent, sibling, husband, wife, or friend looks on in distress. Our understanding is the situation described by the state member for Hornsby is reflected here in Western Sydney as it is in much of New South Wales. The Western Sydney Local Health District Palliative Care Service has no capacity for medical home visits. With a population of around 800,000, it has only 4.8 FTE palliative care staff specialists, including St. Joseph's Hospital Palliative Care Service, well below the recommended 8 to 12 FTE needed to meet Palliative Care Australia recommendations of 1 to 1.5 specialists per 100,000. My question is, will this government commit to investing the necessary funds to meet the existing and anticipated future demands for such service, and more specifically, fund the necessary positions for the Western Sydney Local Health District's palliative care service to be able to provide medical home visits?
Thank you. And if you were here earlier, you would have heard me say that we've committed to developing a palliative care plan for the state in recognition of the dearth of services in palliative care. It will take some time before we can address all the areas of shortage, but the palliative care plan will be released within a few weeks, along with a request for organisations to submit their ideas about how we can provide additional palliative care services, particularly in the community, and particularly where there are a shortage of palliative care services. I have to tell you that Western Sydney, you might have identified a shortage here in Western Sydney. There's an even greater shortage out in country New South Wales, and we will be trying to address all of those over time. But it is something that we recognise. The Premier spoke about it in Parliament when there was a motion debated in Parliament. Both he and I made that commitment then to have the palliative care plan, and there's been money allocated in this year's budget to increase funding. I think it's about it'll be $10 million or something, and it will be particularly based on providing palliative care in the community.